Hey everyone, it's Dr. Morales again, Linda Marquez.
Hi guys.
All right, we're back at it this week again with another special topic, and that is what plastic surgery procedures are covered by insurance. One of your top questions, right?
Right, that's one of the top questions that I get all the time. It's like, is tummy tucks covered by insurance? And, they think because we're repairing their muscles that is covered. And in fact, it's not. And in fact, most of cosmetic procedures are not covered by insurance. One of the big ones is breast reduction. And that one, can be covered by your insurance, but there are certain criteria that you need to go through for them to be covered, which is a lot. And we took insurance for a while.
I did. I took insurance for 3 years. And, unfortunately, the way our insurance are done now in our society, the hoops that patient has to jump through to get that insurance to pay for that surgery, it's a lot. They have to do physical therapy. They have to do, non-steroidal medications for like a year. They have to visit a chiropractor. They have to have, all these extra things that the patient is putting on the patient to do. And they get a letter from a doctor declaring that they medically need it. And then they see a plastic surgeon who will recommend that you need a breast reduction. And then when you go through this process of being approved, you submit all this information. I would say, 1 in 4 of the times,
1 in 4.
I would be on the phone with the medical director of the insurance company, appealing their denial, spending 30, 45 minutes arguing with these guys. Like, she has triple F breasts. How can she not have symptoms of back pain, rashes under her breasts, difficulty fitting into sports bras, any normal bra, difficulty exercising? Why do I have to prove that to you? You have the pictures, you see this patient obviously needs it and it should be covered. And they're like, well, she hasn't done all these things. And that's where I have no defense on, right? And then we're done. So, those patients that have been approved, how many times did I get approved and then they come back and told me, actually, we're not approving, you're not being reimbursed as a surgeon.
Yeah, and it's heartbreaking when you see that check come through and the bill is $4,000 and we're getting maybe $100.
Yeah, I've been flat out denied. Like, I did the surgery, did a 4-hour surgery, took a patient now like triple G, took him down to like a D, and I got a $0 check. That is real life there. So, and it's getting worse. So it's just the way the insurance is now. You're making it harder for patients, and plastic surgeons take care of those patients. Insurance to pay for it. Cosmetically, I do breast reductions all the time. In my private facility, this is where I only operate. I don't operate in outside facilities anymore where they take insurance. I don't take insurance, so I don't do that anymore. There's surgeons out in the community that will take insurance still, but you still have to go through the process of getting that insurance to approve that surgery. It's very labor intensive, so if you're considering that, you've got to be prepared for that, okay? It's coming. It takes a little more time to get that approved. It's a possibility, yes. I've seen nothing but frustration doing breast reduction specifically. But tummy tucks, hernias, I have a diastasis or I have a hernia. Can you do a hernia repair and then do a tummy tuck? That's called insurance fraud. We don't do that, okay? So abdominoplasty, body contouring, it's 100% cosmetic, and it's you need to look at it that way. So if you're gonna come in the office and ask for an insurance to cover a specific surgery, there's a good chance I'm telling you no. That's reality, right?
That is reality, and especially BBLs, guys. Insurance does not cover BBLs.
No, that's strictly augmentation with no fat, so there's no insurance coverage there. But so these questions come up, and people just don't know, which is okay. And that's why we're doing these educational videos for me to talk. You hear from me. I've told you already. So now I don't want to embarrass you. Just hope you learned something from this. So thanks for following. Appreciate your time.
Thank you guys.